Welcome back to Health and Healing by Dr. Saraswathi Kalvakota. And yet again, we're going to embark on diabetes and diabetes management. That is our part 2 here. And let me introduce our wonderful subject matter expert yet again. Dr. Saraswathi Kalvakota is a board-certified internist and pediatrician, assistant clinical professor at Wright State University, Boonshoft School of Medicine, Dayton, Ohio, USA. She has over 30 years of wonderful clinical experience in primary care, a proud member of API, American Association of Physicians of India origin life member. She's done a lot of community and social services and promoted health, hygiene, and preventive health services. She's also a proud founder and president of Maitri International Organization, a non-profit registered organization established in 2006. So let me welcome Dr. Saraswathi to our show Health and Healing. Welcome back, Dr. Saraswathi. How are you doing today?
Doing very good. Sharath, thank you for your nice and eloquent introduction. And what we talked last week, several points on diabetes we touched upon. And today we are going to talk about the criteria, how you make the diagnosis, what are the parameters needed for making a diagnosis, and what are the medications, what are the non-medication aspects we need to know. So these are the points we will elaborate on. So you will know, when those who are diabetics already, those you will know what the effects and what you are taking, how it is helping you. And then people who are not diabetics, who are asked to take diabetic medications, they don't have to be panicking. Those who have to take insulin injection, they do not have to be panicking. They really help you daily life quality when you take the medications properly. So the quality of life, you will notice within few days how much you feel better. It really improves your quality of life. So at the same time, do not think that it's not a doable thing, management. It can be managed very, very, very perfectly to your best of ability, and then you just have to be motivated to do that. So having said that, what we are going to do today, I'm going to ask Sharath a question about what he wants to start with.
Definitely. Thank you so much, Dr. Saraswathi. I mean, I'm excited to know more about, the diabetes and diagnostics. And before that, I just wanted to ask my question, and a friend's question. There's a lot of confusion as far as diagnosing oneself. Sometimes people self-diagnose themselves. Sometimes people shun to even approach a doctor. Thinking that that may give them anxiety, and they altogether don't really take care of themselves. But give us exactly what is that diagnostic criteria for diabetes, so that you can have peace of mind.
So answering your question on what's the criteria for making the diabetes, we have 3 factors here. One is hemoglobin A1C, other one is fasting blood sugar, third one is called oral glucose tolerance test. So these are the 3 parameters we take it for making the diagnosis. So what should be hemoglobin A1C for a diabetic? If it is more than 6.5, this is definitely diabetic. If it is in the range of 5.7 to 6.4, you may not have to know all these numbers. It is for to make the diagnosis. but you will eventually learn when you are controlling your own diabetes. You will know all these numbers very quickly. So pre-diabetic stage, as I discussed in the past, that you are neither a diabetic nor a normal person. The hemoglobin A1C is somewhere between 5.7 to 6.4. Anything 6.5, you're already diabetic. So now what is a normal hemoglobin A1C is it should be less than 5.7. So that is A1C. Less than 5.7, you are not diabetic. More than 6.5, you are diabetic. In between, you are pre-diabetic. Okay. Now, fasting blood sugars. Like you fast 12 hours overnight and you get your morning blood sugar. If it is more than 125, actually now American Diabetic Association recommends less than 120. They are even going to 110, but I think it's a very tight control on that. So 120 is the cutoff line for us to say it's abnormal and you are in the diabetic range. What is that? 120 fasting blood sugar. You are in the diabetic range, more than 120. If it is less than 100, you are not diabetic. You're between 100 and 120, that 20 points is making you pre-diabetic. That's two. Third one, oral glucose tolerance test, we call it. That means they give you a loaded glucose in the morning, and then see how you metabolize that glucose in 1 hour, 2 hours. So criteria, sometimes 3 hours too, usually 3 hours. Now, what is the test shows us? If after taking a carbohydrate load of liquid, your blood sugar is 200, you are diabetic. If your blood sugar is 140 and less, you are home free, you're not diabetic. If it is in between, you are pre-diabetic. So 1 point, anytime, it's called random blood sugar. If it is more than 200, you are diabetic. Anytime, afternoon, evening, morning, full meal, no meal. If it is 200 above your blood sugar, you are already diabetic. So two factors are even better. So if your fasting blood sugar is equivocal, you do second time. Then you take the average and then you see which one is correct. So this is the strict criteria for making the diagnosis of diabetes. And at home, this is called glucometer. Everyone is recommended to have this at home, and you check this blood sugar. That comes with a needle and the strips, and you check it in the morning, check it in the evening. If your sugar is not controlled well, until your blood sugar comes to good numbers, you need to check your sugar and glucometer, sugars with the glucometer as frequently as you want, especially pre-meal, post-meal, morning and at bedtime. It's hard to do it. We have new devices come up here. They're called Freestyle Libres. They're attached to the skin, and once it is attached, it goes for 14 days. So you just have to just check it. The sensor gives you the readings. It's not that it's expensive. It is not, some insurances do not pay, but this one, glucometer, is paid by all insurances. The strips and the alcohol swabs and everything comes along with it, paid by the insurance. So this is the oldest and very sensitive test to see your own blood sugar any time of the day. And we recommend it in the morning hours because you are fasting, and that is, that gives us how good your blood sugar in the morning. So that is one other thing. And I think we are going to talk more. I think we have some questions coming up here. And he is not.
Yes. Actually, I have a personal question, Dr. Saraswathi. You just spoke about the diagnostic criteria and how to diagnose yourself. Mm-hmm. And once you're diagnosed, how to monitor your blood sugar levels with a glucometer or a freestyle device attached to your body. But I just have a question about monitoring.
Okay.
What if someone is randomly monitoring themselves, or they are taking? They think that, hey, I'm taking my sugar monitoring, maybe alternate days. Does that work that way, or do diabetic patients have to take? They have to monitor themselves every now and then. How many times a day? Give us a little bit more about that.
Good question, and that is there are a lot of I can spend a lot of time on that because of the constraint. Let me give you important points of what you asked. See, this blood sugar checkups, or we do with the glucometers, home glucometers. You can do it anytime. That is not an issue at all. But we have to know why we are doing. When we are doing it in the morning, we are looking at 12-hour fasting. What is your blood sugar after 12 hours? Is your medicine is controlled? If your medicine is well controlled, your fasting blood sugars should be in the good range. Now, if you take glucometer reading in the afternoon, 1 hour after eating, it's going to be high. There is no doubt about it, because you just had your meal. So it's going to be high. Numbers are going to be high. So if it is 200, it is expected to be 160, no more than 160, even with the medications. But it can go up to 200. So that doesn't help us. It helps us in relation to your fasting or pre-meal or evening meal, prior to your meals, because we know when you are starving what your blood sugars are. So that is our helping numbers to make adjustments with the medications. So that is important. And post meals are also important, but pre-meal is a very important factor for us. We want you to have a good blood sugar number before you take your meal, because every time you take a meal, your blood sugar is going to go up, right? So that is not a surprise. It happens because carbohydrate is there with your food and it's going to go up. Our desire is to see how your body is acting with the medications we are giving you. That's the answer. I hope I answered your question.
Absolutely. You have discarded a lot of confusions for others, and definitely me. I had a few questions and wonderfully answered. Thank you so much. And I'll just jump into the next question. Give us the repercussions or the effects of diabetes as such.
That is where our main discussions are going to be here. I'll be spending a few minutes because people think they can eat anything for a few days and they can starve for a few days, and then that will be fine because it's making up for not eating for a few days, whatever you eat for those next 1 week. So that's not the way of controlling your diabetes, because the long-term effects of diabetes come on whether you starve for 1 week. It's coming on then weeks you do not control yourself, because every time the blood sugar is high, it's going to have an effect on the end organs in our body. So instead of having 1 week of fasting and 1 week of overeating, our suggestion is to keep it in balance. So that way your effects on the tissues and vital organs will be minimized. That is our goal. So vital organs, we are talking about brain, lungs, heart, and our kidneys and liver. So these are important organs which function relentlessly, and they need to have a healthy tissue, healthy oxygen there all the time. 1 week of not having enough is going to have its damage. So now about long-term effects, let's go on to the next slide and see what they are. I divide these long-term effects, or we call it side effects or complications, into two categories. One is acute, other one is chronic. So this diabetes not leaving us if you are not controlled well in a short term. No, it is going to have its own problems when it is too high. And it's going to have problems in the long run too. So both categories have their own problems and they can be devastating. So we divide that into acute and chronic. So what is that happening in acute? When your blood sugar is in 600, 700s, you don't even know you have diabetes. That's a critical time where patients will become delirious, as I just mentioned. They become confused, they become delirious, they have severe abdominal pain, they have severe dehydration, weakness, they can't do anything. You got to be in the hospital. That is the time they get admitted to the hospital. Sometimes they don't eat anything, they're starving, their blood sugar is going down, and they have same symptoms, delirium, confusion. You end up in the hospital too. So these are the acute problems, critical problems needs to be addressed. And that comes from diabetes. So we hope that we do not go into acute problems. However, when patient is not diagnosed with diabetes, they can have this go on for a while, not thinking about it, maybe thinking something else, maybe a virus, maybe something else, and they can go into these critical numbers, and then they end up in the hospital. Then they will come to know that they have diabetes. So that is the acute problem. Yes, the long-term effects, I want to show the organs involved. It involves the eye, it involves your kidneys, it involves your nerves, peripheral nerves, and central nerves, and cardiovascular system, and it involves diabetes, ulcers causing chronic ulcers on the foot, and your cognitive faculty will be affected too. So it affects every organ in the body. So that is the long-term complications. And as we said, it causes, it's the number one cause for kidney failure. So these are the long-term effects, and they are all preventable, provided we can keep the diabetes under control. So let's move on to the next question.
Sure. Thank you so much. That was really eye-opening. That was. I felt as if I'm coming back to senses, listening to the effects about what can be the devastating effects of diabetes. I'm glad you shared with our audience. Jumping into our next question, kindly share, what is the initial non-medical approach towards diabetes, please?
Okay. The question on this is very difficult to answer, and it is difficult. It is simple answer, but very difficult to practice. But I urge all of you to really look at these few slides very carefully, and they are doable. They just have to be motivated. So first thing for diabetes is lifestyle changes. What are those? You have to go into looking into what you're eating, your nutrition, what's your physical activity, what's your sleeping pattern, what is your behavior, support. That behavior means when you are having problems with diabetes, are you having problems, mood changes, and how you recognize related to the diabetes. You need to have that connection. And then last but not least, smoking cessation. That's one factor that can help you immensely to prevent the progression of the disease. Again, prevent the progression of the disease. So quitting smoking, you will be doing a lot of favor to yourself. So next thing is about as I said, nutrition, right? So carbohydrate, this is a plate where you have non-starchy food should be 50%, and the carbohydrate should be 25%, protein should be 25%. So you include protein, you include vegetables, and you include non-starchy foods and carbohydrate. Carbohydrate is here. So you have to have three: protein, fat, and carbohydrate. And always carbohydrate is 50%, because that's where the glucose is coming out. So for the energy. So metabolism is very important. to release the energy in the cells. So this should be your ideal, and you should have plenty of plenty of water daily, which has no calories. Moving on to next one. How much activity do I need, right? So people will ask, okay, I want to practice, I want to start exercise. Before you go for exercise, you want to make sure that you see a doctor, and then make sure that you don't have other problems which can aggravate some walking, your exercise patterns. So the American Diabetic Association says 150 minutes per week. Okay. And the other one, if you're doing intense activity, all that you need is, they said 75 minutes per week. So it's really not a whole lot, but it has to be done ritually every day. So you come to that conclusion of meeting that criteria, 150 minutes per week. And a lot of times I would just suggest that go for 150 minutes because it's not a rigorous, intense exercise. Along with that, include your just weight, lifting few small weights, and that will help to build your tone in your muscles. And that is, we all recommend that too, in addition to that. Okay, now keep your blood hemoglobin A1C less than 6.5. That is the goal for the rest of the life. Once your diagnosis is made, no more than 6.5. A lot of times as we advance, 7 is okay. But keeping the tight control is very important, especially if it is diagnosed at young age, middle age. You have 30, 40, 50 years to go. So you want to keep this at real tight A1C levels. That should be your goal for that.
We'll jump into the last question.
Yeah.
So that, we can get a very succinct message about diabetes. This is very crucial. I mean, even post-pandemic, please tell us, the medical management, strategies of diabetes.
Absolutely. Because we have talked so far only about the non-medical management. I was requesting start with your lifestyle changes, which are basic and most important. Because if we do not do that, our medications we are going to give you, we're going to increase the doses and only to see the side effects because you are not following the basic things. If you do that basic lifestyle changes, our medications are going to be minimal doses and minimal side effects. So first thing is first, lifestyle changes. Next, we come to decide what medications you need. So once you maxed out on your lifestyle, now we know you can't do anything more than that. Now the medicines come into the picture, and we have armamentarium of medications. Okay, there is several drugs are introduced every year, and very potent drugs. So don't get disappointed when taking medicine is something really bad. And, we should continue to do only lifestyle changes and try to control diabetes. Time comes, we may not be able to. So we have so many drugs. Just to give you the numbers, names, glucophage, everybody knows. Fortamet, everybody knows. Trulicity, Tanzium, Vidurian, Victoza. I'm not scaring you. These are medications are given, and these are recently added to the list. And then we have Januvia, we have Onglyza, we have Invokana, Forxiga, and these are all categories like, we biguanides, GLP-1 receptor agonists. You really do not have to know. I'm just mentioning. And we have sulfonylureas, one of the oldest drugs, and insulin is there, and insulin analogs are also there, and combination of the drugs. We have combination of this and this. So some of those combination of drugs are also available. So there is really no dearth of giving and dearth of medications. It is what to choose, when to choose is the responsibility of the physician, and bringing your records, home records, to show to your doctor is your responsibility. So we can tightly control your blood sugar. So I want you to take this message, be motivated, and we will motivate you, and you will motivate us to treat you better too. So that is another thing about diabetes. people live forever, with diabetes. It's not the end of the world. To introduce the diabetic medications, these are insulin. It comes in various forms, the easy way. It is all pre-injected. If you want to take 10 units of insulin, it is already fixed to 10 minutes. It doesn't go more than anything like that when you take the injection. So they are very carefully devised and then very carefully calculated insulin doses and very easily injectable too. So that also is not end of the life. Insulins, people take it for years, decades. I have seen people taking it, and with very, very well controlled diabetes. And just to give you the insulin types, we have so many insulin types. Some of them you take right before your meal because your blood sugar goes up really high and it doesn't last too long. So you just want to take that. That's called regular insulin. And there are other insulins. There are intermediate insulins that last for about 12 hours. And some of the insulins, they last for more than 24 hours. Now the new insulins, which analogs we came in, they're called Trulicity and others. They last for, you only have to take once a week. So there are so many varieties of insulins are there, insulin-related drugs to control diabetes. I just want to bring you the way how they act. These are the hours, and this is the intensity of the medicine. So that's about medications we talked about. So the same thing I just said, short-acting insulin, rapid-acting insulins, long-acting insulins, pre-mixed insulins, and pre-mixed analogs. All categories are available, and that has to be decided by the physician. What is the right drug for you is the crux of the matter. So, any more questions, Sharath?
I mean, it was a wonderful session again, Dr. Saraswathi. I mean, you've taken a subject called diabetes and diabetes management, and you have nailed them down. Given a very clear picture of what are the repercussions and how to not worry about them and take proactive steps, be more responsible towards our life. You also said that it's not the end of the world. We can manage diabetes beautifully, and you have elucidated, explained very beautifully to our audience. I'm really thankful to you for your wonderful explanations. I'm pretty much sure our Mana TV International audience, whoever is is needing this information will be benefited for from our health and healing session. So definitely, thank you so much. That's my my grateful statement. And I just want to before I switch to conclude, in your words again, just give our audience a collective message about is there anything in totality you want those who got diagnosed, to those who are apprehensive of getting diagnosed, a collective message?
Wonderful. I can make it a small synopsis of what we just talked today and last week. In the beginning, I recapped what was discussed last week. Today, our topic has ended on diabetes, and we talked most important section in this diabetes. What we did was we found out the risk factors are there which can be rectified. We also found out that there are several drugs available, medical drugs, for treating diabetes. We also talked about encouraging lifestyle changes. It is the basic first step anyone can do, and it can be doable too. And we also talked about insulin, which is injectable for diabetic patients. And I want you to know that this is a disease which can be controlled, and it is a teamwork which is required between and best understanding between the patient and the doctor. And the more you coordinate, communicate with your numbers with the doctor, the more doctor can do to yourself. So do not think that diabetes is is a difficult disease to control. It is getting more and more. Incidence is going up, and it is in our hands to really bring the incidences gradually, bring it down, reduce the incidences. Like we are seeing cancer leveled off from what it used to be, and we will see in the future the diabetes also will be leveled off. The incidence going up will be neutralized. That means we are already doing better. So our goal is to see it neutralizes, it levels off, and then starts decreasing. That's the first step to happen. So we hope we achieve it. It's only in your hands. That is what that can happen. And please think, stop diabetes, and together we can do it. So good luck to you all. And I want to thank Mana TV International, and also thank intensely Sharath for doing this with me. And we, as a team, we try to give you best of health tips. Thank you.
Thank you, Dr. Saraswathi, for giving us such a lovely and educational session on diabetes. On that note, I'm very sure Mana TV International audience would have enjoyed and learned a lot of golden nuggets from this session. So friends, I'm sure, some points might have triggered you. If so, write to the email which is flashing on the screen. And, we'll come up with more wonderful topics in the future, more episodes on different topics. Dr. Saraswathi is carefully curating, a lot of topics for all of you as far as health, healing, and wellness is concerned. So meet you next week again. Until then, please follow our YouTube channel, Mana TV, Facebook page, Mana TV, and live streaming YUPP TV. Thank you so much.